Well, oftentimes men only seek health care during a crisis, not for regular exams and wellness. Touro Family Medicine Physician Dr. Meredith Maxwell is here to discuss how men can take a proactive approach to their health care as part of National Men's Health Month. Good morning.
Good morning.
So this is obviously a very interesting topic for me and obviously all men. National Men's Health Month, we're trying to put the focus on, hey, look, get a checkup. Make sure that you're healthy. There's nothing wrong with it. That's kind of the message that's been around for a while, right?
Exactly. I think there's the stigma that I'm tough, right?
Mm-hmm.
I'm masculine. I don't have anything wrong with me. I'm not going to go to the doctor. So I think that the thought is that it's not a weakness or that you're a lesser man because you're going to the doctor. I mean, it's actually being smarter. It's actually being proactive. And I think in this time of COVID, I think that it's even more important, especially in the realm of mental health.
Okay, yeah, that's obviously a big thing that can affect anyone. When you're talking about that, I mean, let's kind of dive into that right there.
Yeah.
You know, why do you say mental health is so important? That's not, I mean, you're not saying, hey, you have to go to a psychiatrist. You can go to your physician and kind of get that basic checkup, right?
Exactly. And I think there's a big stigma about the psychiatrist with a lot of people. And I think that there's another one with weakness. So you can reach out. We have a telehealth avenue that is even easier to reach your doctor now to just talk. There are lots of ways that we can help nowadays with a multitude of problems, and I think a lot of people are struggling right now, and men are more likely 4 times as much to commit suicide, probably because of a multitude of factors, but especially today's COVID isolatory kind of place that we're in right now. It's really important, and that can come in your annual checkup, so you can talk about these things during your checkup.
And with the you know, the real emergence of telemedicine, it makes it so much easier. And you're actually seeing more patients reach out that way?
Oh, I am, especially my younger patients. Usually I get the men because their wives make them come, but I feel like they're more apt to reach out and to wait in their own waiting room, their car or their living room, rather than making a trip to the doctor. So use this opportunity and this expansion of the telemedicine to reach out to your doctor and get a checkup and see what you need and see what you're missing. Okay. Be proactive, be smart about it.
Absolutely. What for the guys out there, you know, what should we be looking for? Maybe some tips on, you know, making sure that we're healthy, but what sort of things should we be keeping an eye out for?
So blood pressure is huge. It goes over a multitude of medical problems. You know, your sugars, there's certain things that we look for, that we screen for. Of course, your prostate exam, you know, the colon exam, but every person, we take into account what you've been through, your illnesses, your family's illnesses, your mom, your dad, what you've been exposed to create that personalized plan for you. So let us do that. Let us create that plan so that going forward, 10 years into the future, we can prepare you and get those tests at appropriate times.
So, Doc, is it fair to say that getting your checkup makes you a better man?
I think so.
All right. Thank you.
And your wife will be proud, too.
Oh, I know she will. I know she will. Thank you so much, Dr. Meredith Maxwell. We appreciate you joining us as always.
Definitely.